On July 4th, 1776, there was the Declaration of Independence. And it said, the most important things is life, liberty, and the pursuit of happiness. Now, obviously, we need to look into the relationships towards others in a government and the relationships towards ourselves in democracy. And the question is, how does democratic health look like? Do I still need a doctor that decides everything for me, or can I do this myself? So we need to take care of the state we live in both perspectives, the governmental state, but also the physical state, the state of healthcare. So this is why I'm convinced that a more democratized healthcare also produces more happiness to us as individuals. This comes with a responsibility, obviously, and how we can produce more democratization of healthcare, this is what I want to be talking about. We'll be talking about mobile doctors' offices that we built. We'll be talking about no doctors' offices in areas where there are no doctors. We are seeking for equal access to healthcare because basically this is part of our constitution. I will talk about the usage of artificial intelligence, how we discover new medication to reduce unnecessary suffering. And I'll be talking about things that we can explore together. So I want you to become part of a healthcare democratization movement. It is not about what others did. So I'm not going to talk about what others do. I'm talking about what my team and myself were doing. So I want you to become, in the best sense, a healthcare futurist. You might ask, what is a futurist after all? My idea is a futurist is a historian turned forward and a team player. So we need to look into history and we need to build teams. Creating the future is always a team effort and not a spectator sport. Don't stand by. Become active. And I will tell you what you could do. I was already introduced. My name is Tobias Gantner. I'm a medical doctor by training. I used to work as a transplant surgeon. I have a degree in business and law and philosophy, and I get bored pretty easily. My wife can tell. So I get engaged with a lot of things like artificial intelligence, telemedicine, production of medical devices, and overall promising technologies, which you see here. Recently, the Stern, which is one of the German weekly magazine, dropped by our office, our lab, and they were so engaged with what we were doing, so they start calling me the Q of healthcare. Q as in James Bond, the quartermaster. So yeah, I really like that because the Q helped James Bond with fancy tech to stay alive. And basically staying alive is one of the most important things that we as doctors look into. Almost 20 years ago, I started my career in transplant surgery. I was a young doctor in residency, and I talked with people that were on dialysis. Usually people wait for 5 years to get a new kidney transplant. And if you get a kidney transplant, your life can turn back to normal. So at one point in time, a patient came with his son, and that son was kind of agitated. He was like, why is my father not receiving an organ transplant? He's been on dialysis for 5 years now, and recently another guy got an organ transplant that was there shorter for dialysis. So I explained to him how the transplantation waiting list works, and when the guy was already leaving, I was like, actually, do you have an organ donor card? And he was like, no, I don't have an organ donor card. Well, have you thought about having an organ donor card? No, why should I? And then I told him, look, there is a correspondence between your dad not receiving an organ and people don't making up their minds about how they can contribute in healthcare. This, to me, changed the whole way of thinking. It never occurred to him in the first place because nobody had told him. So the question is, how can I take democratic decisions in a healthcare system that I'm part of when I don't have anybody to tell me my choices and my options? Eventually, I thought, it's important to form an opinion. I don't say everybody needs to have an organ donor card, but you have to have an opinion about it. And if you have no opinion, you lose, and other people lose as well. This is the idea that I thought I'd rather not stay in a hospital, but I do something else with my life. And eventually, the idea of the healthcare futurists were born. I wanted people to get educated, to take educated decisions. And my company revolves around this, educating people, not just people in big cities, but people in the countryside, people like you and me. So I understood we need to fix the future. And being a child of the 80s, I figured that the right time to fix the future is always about now. But there is no such thing as a job description, fixing the future, apply here. And after all, I had a good job, well paid and competitive. I had studied medicine in China and in the US and in Switzerland and a couple of other countries. And I love what I do. I love being a doctor. However, I understood that medicine is more than just healing people. It's not a mere science, it's an aggregate of skills. You need to know medicine, you need to know law, you need to know business, and after all, you need to know ethics. There was no such thing bringing all these things together. So this is why I founded the Healthcare Futurist. And the idea is we need to look into democratization. Technology is a tool for democratization. MP3 democratized music. And the cars democratized mobility. What will democratize healthcare as we know it? Will this be artificial intelligence? Let's be there. I wanted to be there, and I'm trying to be a part of this democratic process. So this is where I want to take you on board with me. The healthcare system as we have it is a sick system. It faces a lot of challenges: demographic change, scarcity of personnel, financial turmoil, environmental disaster, just to name a few. We need to adapt. We need to be audacious, not desperate. Technology is an enabler. It's not the answer, but it's an enabler to help us find answers. So we need to consider what kind of technology we want to have to find an answer to this systemic question. And this is what I'm talking about. I plead for a more human-centric approach. I'm not talking about longevity. I'm not talking about biohacking. I'm not talking about self-optimization. I'm talking about the mere healthcare system that we use on an everyday basis. Digital tools in the healthcare system were invented to solve administrative tasks. This is why doctors usually hate digital transformation, because it was just an administrative kind of thing. We focus on administration rather than on customer or patient experience. And this is like you install an SAP program, a warehouse program, on a PlayStation, and you wonder that you don't have fun fumbling with it. So we need to rethink how we do healthcare. And this is where the healthcare futurists come in. We are driven by fun and curiosity. We're working with the mouse. We have worked with more than 150 families of all walks of life, introduced healthcare technology of the future to them, 3D printing of medicine, virtual and augmented reality. We wanted to crop their ideas to see what they think where healthcare shows up and what we need to do in the future. With our Healthcare Maker Mobile, which is a van that we have refurbished completely, we make digital transformation in healthcare tangible. We go places in Europe, we talk with people, we show them the advantages, but also the disadvantages and the risks and perils of digital transformation in healthcare. We have built a healthcare Tomorrowland, and we go to places where people live that are underprivileged. We talk with them, we take them seriously. We want them to be part of the healthcare system, because after all, if they fall sick and can't go work, there will be expensive costs coming our way. So I believe in prevention. I believe in education. We work with people that are professional Lego builders, because if you have an idea in your mind and you can't run a 3D printer, you put this thing together with Lego. So we've got this Lego table. We build hospitals with Lego. In the background there is our Healthcare Maker Mobile. It also sits here right on the table. We build MRIs. And we're basically trying to rebuild healthcare on a fun way. We start a lot of hackathons. We've done more than 20 full-featured hackathons with rapid prototyping, where people learned how to build things that they needed to have in order to run and lead a better life. This is how winners look like. This group won 20,000 euros. They built their own company. The product is in the market. They solved a problem they had on their own. We look into tech verticals. So we work with the automotive industry. We look in lights in the cars, 1.2 million individual mirrors. The idea is, what can we do with this? We installed this in the dentist chair. We put artificial intelligence into that, and we're now targeting rotten teeth with a laser beam and a light beam, showing the dentist where to drill if the dentist needs to drill. This is Osterburg. Osterburg is a city in Sachsen-Anhalt, north of Magdeburg. They have a problem. They don't have an ophthalmologist anymore. So this lady here was the last ophthalmologist. She closed down her business. She tried desperately to find somebody to take over her practice. She couldn't find anyone. It takes people 6 months to get an ophthalmology appointment. People go blind. This is how we found this out. People were operated on in the university hospital in Magdeburg, and they were desperate because they went blind because they didn't get proper medical care. We're not talking Africa. We're not talking Asia. We're talking Germany. So we thought we need to change this. So we took our healthcare maker mobile and we put a full-featured ophthalmology practice in the car. The physician association said, you can't do this. This is not okay. Go there. Don't do this. We just did it. We just made it possible. So we worked with a big professor at the university hospital who endorsed the idea. We went to the church square like in the Middle Ages with our car. We opened the door and he said, look, we are here. And this is how it works. So this is me. I'm a transplant surgeon, not an ophthalmologist. Examine a patient because it's pretty easy to run these kind of machines. And we connected this to a doctor who was on residence in the remote university hospital. And once the village got wind of ophthalmology doctors being there in the church square, they lined up. It took us more than 10 hours to examine everybody. Nobody was talking about data safety, data security. They were all thankful that basically they had not been left behind. If you're interested in the whole story, we produced a cinematic movie with this. We showed the movie in Magdeburg. We imposed a lot of pressure on local politics. And finally, they opened up their bursary and they gave us 6.5 million euros to run new ophthalmology ideas in the place where we've been. But this was not our first thing that we've done. In 2019, we opened up the first in German Ohne Arztpraxis. The physicians hated it because they thought we'd put them out of business. But there was no physician anymore in that place that we could put out of business. Those were just areas where nobody lived. And if you say, well, we're living in Münster and we have tons of doctors here, you might have relatives somewhere in areas where there is no doctor. And there will be more and more places in this country where we don't have doctors. So what we did is we employed a nurse, we trained the nurse, and the nurse is establishing digital contact to doctors that we are working with, and she or he is examining patients. We moved on. We are now doing this in Lower Saxon-Anhalt in 2 senior citizen homes. We're converting them to healthcare hubs. There are no doctors around. So the senior citizen home is the healthcare hub where people go that need medical care. And of course, not everybody liked that. If we looked at the Kassenärztliche Vereinigung, for example, they're trying to solve new problems with the same way, and they're puzzled that they keep having bad results. Now, my idea is tradition is to pass on the fire and not the consecration of the ashes. So we need to find new ideas. And this is where I talk about the innovator's mindset. And when I talk about how does the innovator's mindset look like, it is the one question that I always ask myself: what will I be ashamed of in the future that I could have done today but didn't do? And if you think, well, okay, I'm innovative, I have the innovator's mindset, there's one thing I want to give you, is don't believe everything you think. Now here's a little story. I have a son, 6 years old. And this little son came up a couple of days ago and said, look, Daddy, I know how the dinosaurs got extinct. And I was like, okay, how did that happen? Well, that was not a meteor, They got extinct because they couldn't wash their hands. So this little boy spent 2/3 of his life in a pandemia. So this was his reasoning and reckoning. And this isn't the innovator's mindset. Don't believe everything you think. And it could well happen that the dinosaurs couldn't wash their hands and got extinct. Proof the contrary. We have a problem in healthcare. We have eminence-based medicine, a lot of. So there you've got your big cheeses, your big attendings that say, well, we've always done it that way. And it will never change because my teacher did it that way and his teacher did it that way. Well, we're kind of moving on into evidence-based medicine. This is like you're not looking at one bird in a flock of birds, you're looking at 100 or 1,000 birds. Still too little because you want to know what's going on. Where is this flock of birds flying? So now with data, ubiquitous, computers, smartwatches, well, you have it. We're going into the age of emergence-based medicine. So we can look at the whole swarm of birds and we can understand much more. But for this, we need data. So having started out as a transplant surgeon who relied on data on organ donation, I now rely on data donation. I think this is the next big thing. We can all donate our data, which is good, because if you donate a kidney, you only have one kidney left. If you donate your data, you still have your data. Of course, we need to talk about this. But we can gather tons of data to understand where this swarm is flying. We could have found out earlier who will be affected severely by corona. We just didn't do this. We will be ashamed in the future that we had not taken up the opportunity to do this. When I talk about democratization of healthcare, I rather think of this guy. This is Immanuel Kant. And Immanuel Kant said, enlightenment is the emancipation from the self-inflicted unreasonableness. Sapere aude, use your own brain. I bet you, if Immanuel Kant would live now, he would get a kick out of checking and tracking his blood works and his lab works and so forth. So the point to me is, dare to use your data. Kant said, dare to use your brain. I say, dare to use your data. What will happen if at some distant time in the future there will be a patient's declaration of independence from doctors, from big cheese professors? Would we still be talking about sick care, or would we really be talking about health care? How much technology would we be having? And how would we be financing the healthcare system? We should be talking about this. And as we speak, new legislations come into place. We should all be knowing about what the future will hold. Now, this is forward. Let's go a little bit backward. The role of doctors are changing. So the doctor used to be the know-it-all guy, but he also used to be the healer and the consultant. So it's an anthropologic mixture of things that doctors need to bring by. You see this in this picture that's actually been created by an artificial intelligence, which is a doctor, but also wearing a priest's gown, using a tablet. I think this reveals quite a bit of what the future will be holding like. Will we be needing doctors as we have them? Will we be needing doctors just to talk with them? You might say yes. I don't know. Maybe we don't have enough doctors, we don't have enough medical stuff. Still, we are craving to see persons. However, artificial intelligence, and we need to debate about this, is getting better by the day. So there was a JAMA publication just a couple of weeks ago where patients could decide whether the treatment by a doctor was better in terms of quality and better in terms of empathy. And a statistically significant number of people chose the artificial intelligence over the doctor. We need to look into these things. And my last sentence is, innovation always comes at a risk. The highest risk, however, entailed with innovation is the one for your own prejudices. Thank you very much.